Health, and I'm here with, do you want to introduce yourself?
So I'm Megan Coleman. I'm a nurse practitioner at Whitman Walker Health in Washington, D.C.
So we're in Washington, D.C. It's May 2015, and let's set the context for Whitman Walker. It's a federally qualified health clinic. You see about half HIV negative, half HIV positive people. And came here to talk with you about PrEP implementation because you guys have been early adopters or implementers of PrEP. And one of the things that is challenging or perceived to be challenging by providers to implement PrEP is the sexual screen. That it's going to take a lot of time. How do you ask these questions? And you actually have a list of questions that you generally or you try to ask all of your patients. Tell me how that goes.
I do. So I understand feeling uncomfortable because I was very uncomfortable when I started, but just having this list of questions made it easier in my head, and asking everyone makes it easier, and there's no misconceptions by anybody. So I just start off telling every patient that walks in the door that I ask the same questions of everyone that comes in. If anything makes you uncomfortable, just let me know and I'll stop. I ask clients, male or female, if they have sex with men, women, or both. Mm-hmm. And then I ask them if they use condoms for their sexual encounters. And then I ask them what type of sexual encounters they have. From that, I'm able to go in a couple different directions. So I can talk about pregnancy or contraception, I can talk about STDs, I can talk about HIV, and I can talk about PrEP. So I'm able to build a risk analysis and more of a conversation about their risk based on those three simple questions.
And then when you ask someone that, how do you remember it or document it?
So we have an electronic medical record, and so it goes into our social history conversation. So it's tied in with tobacco, it's tied in with alcohol use, it's tied in with their nutrition. It's just part of what makes a holistic approach, I guess, to seeing the patient.
Mm-hmm. And then do you ask people this when you first see them, every time you see them? Like, how does the story keep going?
So I ask people every time, the first time I see them, patients that identify potential risk areas or areas that they could use more education or more time spent with me discussing it, because obviously a 15-minute appointment we're not able to cover everything. Mm-hmm. I kind of mark it for future conversations, and especially our clients who are on PrEP or interested about PrEP or interested about pregnancy or interested about contraception. It becomes more of a conversation that we have at routine visits.
It's like the door's open then, but you're not doing this whole sexual history every time.
No, it's a little piece at the time. And I think as people get more and more comfortable with me, they share more and more. And so I'm able to provide more targeted education.
I love it. Thank you for sharing. It's so awesome. All right.
It's been great.